Hi everybody, it's Terry and today I'm going to talk about heart disease, and I'm going to specifically focus on heart disease with women because a lot of people don't realize how prevalent it is for women to have heart attacks. So anyway, 1 out of 31 women die from breast cancer and 1 out of 3 die from cardiovascular disease, and that includes heart attack and stroke. That's 10 times as many as breast cancer. So, as you can see, it is very prevalent. So what are the risk factors of heart disease? Well, there's some things you can't do anything about, like your age. The older you are, the higher incidence. Your sex, if you're a man, you have a higher chance of having a heart attack. Hereditary. If you've got a lot of people in your family that have had heart attacks, you have a higher chance of having a heart attack, so be aware of that. And then some races. Afro-Americans have a higher incidence of heart attacks. But there's also a lot of things that you can do something about. Other risk factors are smoking, really, really bad for you. If you haven't stopped smoking, find a way. There's some free smoking websites and hotlines, and now there's some medications out there that can really make a difference and help you stop smoking. High cholesterol, hypertension, not taking your meds when you're supposed to, diabetes, inactivity, and stress, and then also alcohol and birth control pills. So stress can have a big impact. When I used to work critical care, it wasn't unusual to get patients in on like big game days even when their team was winning, sometimes people would have a heart attack because they got themselves so excited, and definitely if their team lost. But anyway, so what are some of the classic symptoms of heart attack? The common ones are chest tightness, chest pressure. People complain of it feeling like there's a Mack truck on their chest. They might have pain radiating down their left arm, their jaw, their neck, maybe some shortness of breath. It's very common to have diaphoresis or sweating, and maybe even some nausea. Now women, they can have any of these same classic signs, or they could have none of the above. Maybe just jaw pain, maybe just back pain, or shortness of breath, or they just feel so tired and they don't know why. It's just so very important to listen to your body and pay attention, and if you're concerned at all, call 911. And it's just so important. If you make a mistake and get to the hospital and nothing was going on, it's better to be safe than sorry because seconds do count. And then also kind of pay attention to wherever the defibrillators are in your workplace, in some of the event places that you go. Because that could help save somebody's life. The instructions are pretty self-explanatory now on how to do those. And if you haven't taken CPR lately, there have been some changes in it, and I really do recommend that you contact the American Red Cross, and often they're free, and take some CPR classes. It could save someone's life that you love, and it's just or someone you don't know, but it's really important to try to learn how to do that. And that's about all I have today. So if you have any of those risk factors for heart disease, all of you are doing something about the obesity part and being overweight right now, and I congratulate you for that. And just hang in there. If you're having a rough week or a rough day, know that it will get better. It's just a bump in the road, and just keep focused on going forward, and you will, the more days that you do it right and that you make progress, the closer you're getting to health and getting your weight off. Thanks a lot and take care. Have a great day.